Well, before all that, ITV News has learned that the UK's medicines watchdog has been alerted to 18 deaths with suspected links to weight loss injections. Now, these types of drugs should only be available on prescription and were originally used for treating people with type 2 diabetes. But our investigation has uncovered a growing demand for these weight loss injections, both from registered online pharmacies and indeed the black market. And one sufferer told us people think it's a miracle injection, but it can cause long-term medical problems. Here's our health correspondent, Rebecca Barry.
Your body feels better. You feel more energy. You feel a happier place mentally.
On chat shows, social media and news sites.
The skinny jab pen really curbs my appetite.
Much talk of weight loss injections.
This drug will be very helpful to people who want to lose weight, need to lose weight.
Promising miraculous results. But what about the risks?
Sometimes you're at that low a point in your life where you just want to do anything to lose weight and feel how you used to feel.
After having children, Lorna struggled to lose weight, affecting her mental health.
I'd seen really good results on social media. That's when I thought, you know what, I'm going to go to my doctors for some help.
But with a BMI of 28, not obese, she didn't qualify for weight loss jabs on the NHS. So she bought them privately online from a registered pharmacy and soon saw the results.
I didn't feel, the need to eat. So within the first 3 weeks, I did lose a stone and I thought, this is amazing.
But then things suddenly took a turn for the worse. She developed pancreatitis, a potentially fatal condition that causes inflammation of the pancreas.
I just collapsed on the bathroom floor. It felt like I'd had a car crash inside.
She spent a week in hospital and months recovering. The hardest part, not being a mum to her 2 kids.
Seeing them frightened, it just isn't worth that. I couldn't walk. I was bedridden. I couldn't drive. I couldn't get down steps. I couldn't even hardly go to the toilet. Couldn't take my kids to school.
She had to have her gallbladder removed and now lives with chronic bowel problems.
People just think it's a miracle injection and you get skinny. I don't think people really are aware that it can cause long-term medical conditions.
All medicines carry a risk of potential side effects, and weight loss drugs are no exception. The most common risk affecting more than 1 in 10 patients is gastrointestinal problems like vomiting and diarrhoea. But there are also less common, more serious side effects like gallbladder disorders and pancreatitis, which can be fatal. ITV News can reveal that in the last 4 years, the medicines regulator, the MHRA, has received reports of 18 deaths with suspected links to the weight loss drugs semaglutide, liraglutide and tirzepatide. And in 10 of those cases, the drugs were being used for weight loss only. In 8 cases, they were being used for weight loss alongside diabetes treatment.
Every shift I did, I would see at least one patient with something related to this.
This A&E consultant working on Merseyside regularly sees patients with complications related to weight loss drugs.
Most of the patients that I've seen have been people that have got it from an online source, so they've gone to an online pharmacy. But I've also treated somebody who was telling me how they got it from somebody in a plastic bag in a car park.
24-year-old Paige Roberts has polycystic ovary syndrome, a condition that can lead to weight gain. She feels insecure about her body.
I mentioned something to a friend that says, I know someone who sells these jabs, I can get some for you. And that's where it all started.
She paid £80 for 4 pre-filled syringes. She injected herself in the stomach and the next morning went to work as usual.
I threw up all into the bathroom and I phoned my mum, panicking. I'm being sick, I can't stop.
After 3 days, her family took her to hospital.
I was thinking, I feel like I've injected some poison into my body. I don't know what's going on. I've got no energy. I need to lie down.
What were your worst fears?
That I was actually going to die. Scariest thing I've ever been through in my life.
When Paige bought this from an unregulated seller, there was no way of knowing for sure exactly what was in it. So we brought it here to a laboratory in Sunderland to get it tested.
If you take a medicine which has not gone through quality control, you now open yourself up to more dangerous side effects.
The tests found that these syringes do contain semaglutide, a weight loss drug which can only be prescribed by registered healthcare professionals. Medicines bought on the black market haven't been through rigorous testing, bringing real risks.
Anyone who's producing these in a DIY environment is trying to maximise profits and cut costs, so I'd be very surprised if they were taking the due diligence to perform all of the necessary tests that are required. Especially with injectables, you are breaching your body's defences. So by injecting the material straight into your body, you run the risk of introducing pathogens that could cause anything from mild irritation, inflammation, up to toxic effects, fever, and beyond.
When used appropriately for weight loss or type 2 diabetes, regulators say that the benefits of these medications outweigh the risks. But that risk-benefit balance is thrown the other way if used by people who are not obese or diabetic or without proper regulation and medical guidance.
The most senior doctor in NHS England says for people with obesity, these drugs can be a valuable tool.
The important thing is that these are drugs. They are prescribed medications, and like all drugs, they have side effects, and therefore they should be only prescribed to those who clinicians are sure will get a benefit. They're not something you should take just to lose a few pounds in weight. If you want to look better and you're otherwise healthy, these should be targeted at people who will get the benefit.
We contacted two of the leading UK suppliers of weight loss drugs. They told us they act in accordance with global and UK regulatory requirements and stress that patients should only take these medications under the strict supervision of a healthcare professional.
Well, Rebecca's here. I mean, people are going to be watching this who are taking this stuff on prescription from their doctors. Should they be concerned as well?
Well, just to reiterate, if you are taking these drugs on prescription for obesity or type 2 diabetes, the benefits outweigh the risks. In the UK, we have something called the Yellow Card Scheme, in which healthcare professionals or members of the public can report safety concerns about medicines to the regulator, the MHRA. That's where this figure of 18 deaths comes from. But it's important to point out that reported adverse reactions or deaths don't necessarily prove that the drug caused that, just that there's a suspected link. Last month, the medicines regulator gave out guidance to doctors saying that they should warn their patients about the potential side effects and to look out for misuse. The other big problem that you heard in that report is the black market. I mean, I've got here the drugs which Paige bought on the black market. You can see they're in a shiny pink packet. They certainly
don't look very medical, do they?
They don't look like a serious drug with potentially serious side effects, but they are. And I think that message needs to get through.
Yeah, Rebecca Barry, thank you.